Hi there, everyone. Welcome to another episode with Dr. Tie Wrap Bath Towel. This is an episode of hospitalization and shower thoughts. So, as you can see, Dr. Tie Wrap Bath Towel here is getting ready for a shower, and while you're getting ready for your hospitalization or surgery. So, typically, you go to the hospital with pain or due to pain. It could be abdominal pain, and you may be diagnosed with appendicitis. It could be a headache, and you may be diagnosed with a tumor. It could be back pain, where you might be diagnosed with a fracture. So all these, or some of these, might lead to surgery. So how do you get ready for the surgery, and how do you cope with the surgery? This is what we're going to be talking about. So first step, you go to the ED because you have pain. When you go to the ED, you state what your problem is, then you will be triaged. And as you're being triaged, this means they take your information and then they decide what level of care should you receive. Who should be number one? Who should be number two? Based on their symptoms. Somebody coming in for constant sneezing is different from somebody coming in for a seizure, and also different from somebody coming in from due to constant vomiting or severe pain. So everybody is different. So in the ED, they will run some labs. They will do some scans like CAT scan, MRI. You might have medications or IV fluid. So just be patient. You understand, you come in with one problem. Say the doctor orders a CAT scan, labs, an X-ray, IV fluids, or probably an MRI. These are different departments and different staff members. So the lab staff might not be free at that time to draw the lab because remember, you're not the only person. Or the CAT scan room might be busy at the moment. They might have 2 or 3 patients in front of you. So while you wait there with your pain, they can't really do anything at that time because they're waiting for the CAT scan result to be able to treat you. So now this is when patients start to get mad or agitated and saying, oh, how come nobody's doing this and doing that and doing that? And then maybe you just had breakfast and close to the time you were going to have lunch is when your symptoms started. So you came to the hospital and you've been there for a while and now you're hungry and you're not getting anything to eat. So then you start to get agitated. So you have to understand that all the staff members are working fast enough to take care of your problem. So hopefully this video will help with your anxiety or your anticipation. Like, how come nothing is being done? Things are being done, but sometimes they have people in front of you. And then, so after all this scan and this test, if the doctor decides that, okay, you're going to be admitted for surgery because today we're discussing surgery, then you will be, the doctor will give an order to admit you to inpatient for surgery. Now, for you to be admitted to inpatient, for they have to have a room, and the room most of the time has to be available in the unit you're going to. If you're having a seizure, you want to go to the right unit, like the neuro unit. If if you have anything with your heart, you want to go to like the cardiac unit. So typically, they want to send you to the right unit, and based also on the availability of the bed, that's where you want to go. The reason you want to go to the right unit is because some equipment are only available in that unit. So now, while you've been ready to be sent to the unit to be admitted into the inpatient, you have to wait for transport. Now, transport sometimes might be busy based on the amount of people they have to transport. So then you're going to be taken to the unit by either a stretcher or hospital bed. When you get to the unit, you can have a private room or a shared room. A private room is usually reserved for patients with infectious diseases like TB, COVID, the flu, or you have like C. diff or E. coli. So then if you go to a shared room, that's where you have a roommate and your room is, the room is divided with a curtain. When you get to the unit now, you also have to be admitted into the unit. So don't get upset, like, oh, they already asked me all this information in the unit, in the ED. Why do you have to ask me again? It's a two different unit, two different system. So this just helps you. Now, if you say, why is that the case? Well, that's how it is made. You know, the doctors don't make the rules. They don't own the hospital. That's just how it is. The system, that's just how the system is. So you're going to be admitted in the unit. In the unit now, the doctor might decide for you to be NPO, which means nothing by mouth. You can't eat or drink anything. This is usually if they have to do surgery for you, or in case of somebody with abdominal issues, they want to rest their stomach for a while, to make sure to see what is going on in the stomach. So they don't want to eat or drink anything. Now, they may give you IV fluids. They may give you medications. It could be by mouth or IVs. Or they may order you to eat food. Depends. But most of the time, if they order you not to eat, it's usually because your case might be early morning case or like 8 o'clock, 7 o'clock case. And if you're getting admitted at 2 o'clock in the morning, you don't want to eat at that time because it's too close for your surgery time. That might delay your surgery. And you don't want that because you want to get the surgery done as well because of your pain or your symptoms. So then after that, in the morning, the doctor might come and see you for your surgery, or they may take you to the lab for more testing, or they may come and draw some labs. Now, if not that's the case, they may take you to surgery. You go to surgery. After surgery, you come back to what is called the PACU, which is like the step down from the OR. This is a recovery unit where you recover. And if you recover fine, sometimes you may go home from there. Other times you may go back to the unit, to your inpatient units, where you could be observed for 24 hours or longer, depending on how your symptom is. And then you may be discharged. So these are the steps that happen during your hospitalization stay. So I hope you can send this message to someone who's in a hospital, or someone who's afraid to go to the hospital, or somebody who might be waiting in the ED at this time, in the emergency department at this time, and wanting to be admitted into a hospital. This might help to reduce their anxiety. Please like, share, subscribe, and let us know if you want any other video to be made. I want you to state it in the comment below. Thank you very much, and hope to see you guys soon.